Welcome to AI Explains Everything, where we'll delve into the complex world of the American healthcare system. In this episode, we'll start with the basics, covering the primary players, funding sources, and healthcare delivery methods in the U.S. The American healthcare system is one of the most complex and expensive systems in the world, with a combination of public and private funding sources, a vast network of providers, and a range of health insurance options. In this article, we will explore the history, structure, challenges, and future of the American healthcare system. Part 1. History. The history of the American healthcare system can be traced back to the early colonial period, when physicians were few and far between, and medical knowledge was limited. As the population grew and medical knowledge expanded, medical schools were established, and the first hospitals were built. However, healthcare remained largely a private affair, with patients paying out of pocket for their medical care. In the early 20th century, the American Medical Association, AMA, began lobbying for greater regulation of the medical profession, including standardization of medical education and licensing requirements. This led to the creation of the first federal health agency, the U.S. Public Health Service, in 1912. During the Great Depression, President Franklin D. Roosevelt established Social Security, which included provisions for health insurance for certain groups, such as retired workers. In the 1940s, during World War II, the federal government imposed wage and price controls, which led many employers to offer health insurance as a way to attract and retain workers. This led to the growth of employer-sponsored health insurance, which remains a dominant feature of the American healthcare system today. In the 1960s, President Lyndon B. Johnson signed into law the Medicare and Medicaid programs, which provided health insurance for the elderly, disabled, and low-income Americans. Since then, the American healthcare system has undergone numerous reforms, including the Affordable Care Act, ACA, signed into law by President Barack Obama in 2010. Part 2. Structure. The American healthcare system is a complex mix of public and private funding sources, providers, and insurance options. Let's take a closer look at each of these elements. Funding sources. The American healthcare system is funded by a combination of public and private sources. Public sources include Medicare, Medicaid, and the Veterans Health Administration, while private sources include employer-sponsored health insurance and individual health insurance purchased on the private market. Providers. The American healthcare system includes a vast network of providers, including physicians, hospitals, clinics, nursing homes, and home health agencies. Providers can be private, nonprofit, or government-run. Insurance options. Americans have a variety of health insurance options, including employer-sponsored insurance, individual insurance purchased on the private market, Medicare, Medicaid, and the Children's Health Insurance Program, CHIP. Part 3. Challenges. Despite the significant resources dedicated to the American healthcare system, it faces a number of challenges, including cost. The American healthcare system is one of the most expensive in the world, with total healthcare spending reaching $3.8 trillion in 2019, or 17.7% of GDP. High healthcare costs can lead to financial hardship for individuals and families, and can also strain government budgets. Access. While most Americans have some form of health insurance, there are still many who lack coverage, particularly low-income individuals and those in rural areas. This can lead to delayed or foregone care, which can worsen health outcomes. Quality. Despite its high costs, the American healthcare system does not consistently deliver high-quality care. Some Americans receive excellent care, but others experience medical errors, unnecessary tests and procedures, and other quality issues. Part 4. Future. The future of the American healthcare system is a topic of much debate and speculation. There are several key factors that will shape the direction of healthcare in the U.S. in the coming years. One of the biggest challenges facing the healthcare system is the aging of the population. As the baby boomer generation reaches retirement age and beyond, there will be a significant increase in demand for healthcare services. This will place a strain on the healthcare system, as there will be fewer healthcare providers relative to the number of patients. This could lead to longer wait times for appointments, increased healthcare costs, and lower quality of care. Another major factor is the increasing prevalence of chronic diseases such as diabetes, heart disease, and cancer. These conditions require ongoing treatment and management, which can be expensive and time-consuming. As the population ages, the number of people with chronic diseases is expected to increase, further straining the healthcare system. Advances in technology are also likely to play a significant role in the future of healthcare. Telemedicine, for example, allows patients to receive care remotely, reducing the need for in-person visits and potentially lowering costs. Wearable devices such as smartwatches and fitness trackers can also provide valuable health information, allowing healthcare providers to monitor patients remotely and intervene if necessary. Another potential trend is the move towards a more personalized approach to healthcare. Advances in genomics and other areas of medicine are providing new insights into the individual factors that contribute to health and disease. This could lead to more targeted and effective treatments, as well as increased emphasis on preventive care. However, there are also significant challenges facing the healthcare system in the U.S. One of the biggest is the issue of cost. Healthcare costs in the U.S. are among the highest in the world, and many people struggle to afford even basic care. Addressing this issue will require significant reforms to the way healthcare is delivered and financed, including efforts to reduce waste and inefficiency in the system. Another challenge is the issue of access. Despite the passage of the Affordable Care Act, ACA, in 2010, which expanded access to health insurance, millions of Americans still lack coverage. This can make it difficult for people to access necessary care, leading to worse health outcomes and higher costs in the long run. Finally, there is the issue of disparities in healthcare. People from certain racial and ethnic groups, as well as those from low-income backgrounds, are more likely to experience poor health outcomes and have less access to healthcare services. Addressing these disparities will require a concerted effort to address the root causes of these inequities and ensure that all Americans have access to high-quality, affordable healthcare. The future of the American healthcare system is likely to be shaped by a combination of factors, including an aging population, the increasing prevalence of chronic diseases, advances in technology, and the need to address issues of cost, access, and disparities. Addressing these challenges will require significant reforms to the way healthcare is delivered and financed, as well as a renewed focus on preventive care, personalized medicine, and equitable access to care for all Americans. The American healthcare system is a complex mix of public and private insurance programs that often results in high costs and limited access to care for many Americans. While there are ongoing debates about how to improve the system, any changes are likely to be difficult and will require careful consideration of the interests of all stakeholders. Thanks for joining us, and we'll see you next time on AI Explains Everything.